Alright class, what I'd like to do now is go over Appendix 12 that has to do with our exemplar diarrhea. So let's read this scenario together. A 48-year-old woman presented to the emergency department with complaints of spasmodic abdominal pain, nausea, vomiting, and diarrhea for 2 days. She has been unable to eat since the symptoms began and had experienced 4 to 5 episodes of bloody diarrhea per day. She had not taken her temperature, but has had chills, mild headache, and generalized malaise. She cooked pork chops a day before the symptoms began, but her boyfriend also ate the pork chops and did not get sick. Also, prior to the symptoms, she ate in a seafood restaurant but had no seafood. She recently moved from a nearby state. She has had no pertinent past medical history for any illnesses, including chronic gastrointestinal illnesses. Examination of the patient revealed a pale woman in moderate distress secondary to pain. Bowel sounds were present and hyperactive. She was diffusely tender without rigidity or peritoneal signs. Her lungs were clear on auscultation, and her heart rate was rapid and regular. Examination of her extremities revealed no abnormalities, and a brief neurological exam revealed no deficits. She had orthostatic blood pressure and pulse changes and was extremely dizzy in the sitting and standing positions. What are some causes of this diarrhea? So let's think about it. Many reasons can occur or be present of why someone does have diarrhea. It can result from damage to the intestinal lining caused by some virus or by bacteria or some kind of malabsorption, inflammatory process, bile salt and pancreatic enzyme deficiency, abnormal motility, or presence of osmotically active solutes in the gut. It's hard to say. She may have just a virus. Maybe she did get some kind of food poisoning. Could be any of those reasons. What questions would you ask this patient? So think about it. If you were working down in the emergency room with this patient and you were the nurse that admitted her, what other kinds of questions would you ask her? Things that I was thinking about would be, has this kind of illness ever occurred before? I would ask her how many stools she had that day. What is the consistency of your stools? Is there any blood or mucus in the stool? And we do know that she did have 4 or 5 episodes of bloody diarrhea. And did it occur after you have eaten something specific, which could narrow it down that she did get some food poisoning? And ask her what she ate in the last 48 to 72 hours. She didn't travel outside of the country, but she recently did move from a nearby state. So we definitely want to know a little bit about her traveling. And did she come from somewhere out of the country recently? Have you made any changes to your diet lately? And I would definitely ask her what medication she takes. And with all her other assessment findings, it's obvious that with all these stools that she's having, that she is definitely dehydrated, because she's really having blood pressure issues, probably due to the dehydration from the frequent episodes of diarrhea that she's having, because she's very symptomatic with that blood pressure. She feels very dizzy in the sitting and standing position. So we do have to assess her for dehydration. Think about other ways that we would assess her for dehydration. Thirst, looking at her mucous membranes. Are they dry? Is her mouth dry? Having decreased axillary sweat and a decreased pulse pressure. We don't know what her actual systolic and diastolic blood pressure are, but she is tachycardic, but her heart rate is regular. She does have orthostatic hypotension, probably some poor skin turgor, and many times these patients are very sick and may have even sunken eyes. Those are signs of moderate dehydration. Now, severe dehydration is indicated by worsening orthostatic hypotension. Heart rate continues to increase. Her urinary output is decreased, and she might go into some kind of hypovolemic shock. And if this was a baby, how we would assess dehydration with an infant is lack of tears, may signal a mild dehydration, while decreased urine output, sunken fontanelles, and definitely a delayed capillary refill and increasing lethargy may signal moderate dehydration. So let's think about what her problems actually are. Obviously, an alteration in elimination, an alteration in perfusion due to the fact that she has decreased vascular volume, and it has now affected her blood pressure and heart rate. Alteration in nutrition, and now she has at risk for alteration in skin integrity, obviously with the frequent bloody diarrhea that she's having, a risk for alteration in immunity, and a risk for alteration in comfort. She has a headache, and I'm trying to look back about if she had any. She is in moderate distress secondary to pain, and risk for alteration in coping. So think about what we would do for this patient. What nursing interventions would be appropriate for this patient? We got to get her hydrated again. So if she's able to take oral fluids, we might offer her small and frequent sips of clear liquids, things that are isotonic, water, Pedialyte. Might want to give her Gatorade or Powerade. We would avoid sweet or salty fluids and encourage her to eat bland foods and yogurt. Depending on what the doctors thought, we may start an IV for her and give her some fluids in the ER as well. Assess her skin integrity, looking at skin care, no soaps, toilet paper, washcloths, or towels. Those are very abrasive to the skin. Just gentle washing with absorbent cotton, dampen with warm water, and keeping that perineal area dry. When she feels up to it, we may get her in a sitz bath for 10 minutes, 2 to 3 times per day, using protective barrier creams. And again, if this is caused by some kind of bacteria, we would encourage good hand washing techniques to limit that spread of fecal-oral, spread of the enteric pathogens. So, and definitely treat her pain as well. And then continue to assess the consistency and the look of the diarrhea to see, if that bloodiness, which is probably due to the irritation of the intestinal mucosa, and continue to assess her for chills and fever. She probably has a fever. They haven't taken her temperature yet, but she does have the chills, and she feels really pretty lousy as well. So that's how we would evaluate this patient. Diarrhea can be very serious. I'm sure they're going to do numerous amounts of lab work on her, especially a chem profile looking at her CBC and DIF and assessing her electrolytes, particularly sodium and potassium. You do lose a lot of electrolytes through constant diarrhea, and we would want to be very concerned if she had low sodium and potassium levels as well. All right, that pretty much concludes the activities that we're going to do. The last thing that we're going to do related to these 2 exemplars is to play the elimination game. So let me bring that up and we'll do some of the questions together. All right, Class, I've got the elimination incontinence game up here, so we can play this together. Now, I know some of you, since it's already uploaded in Canvas, have probably already played this, but it's a good review, so follow along with us. And we'll just say Nursing 121. So we will start. Incontinence, either urinary or fecal, can lead to skin breakdown caused by fecal enzymes and wet skin. Of course that's true. This is the reason why the skin must be kept clean. The urethra is the duct by which urine is discharged from the bladder. In men, the urethra is how long? This just goes back to your anatomy and physiology. Oh no, I put it's 20 centimeters. When the lower urinary tract and bowel functions are normal, but the person is still incontinent, this is called, what kind of incontinence is this? Absolutely, it's functional incontinence. Which medication should be used with patients who need to avoid straining and work within 1 to 2 days? I'll let you guys think about the answer. I'm going to choose fecal softeners, and that's the answer. Bladder training is an effective treatment to urgency incontinence because results can be achieved within days. Is that true or false? It is false. Patient commitment is important because improvement can take between 3 and 6 months or even longer. So that's a very, very slow process. Which medication is used with acute constipation and is effective within 8 to 12 hours? Would it be stimulant laxatives? Absolutely. And you're getting that information in your Nursing 123. Vaginal cones, a weight training device for strengthening the pelvic floor muscles, can help reduce stress incontinence in older women. Was this one of the therapies that I talked about in regards to stress incontinence? No, it's false. There is no evidence that these are effective in older women. So the answer is false. Which medications is used with chronic constipation? However, it may take up to 3 days to be effective, so it is not suitable for rapid relief. Might be bulk forming? No, it's osmotic laxatives. Due to physiological changes, urine production often increases at night in older people, leading to disturbed sleep. Is that true or is that false? It's true, because they need to get out of bed and go pee. Continue. About 50% of cases of fecal incontinence are caused by constipation. Is that true or false? Think about it. I'm going to say true. Yes. This is because a partial blockage caused by hard feces, which partially stops new waste products from being passed, leads to loose fecal matter passing around the partial blockage. The ureter is the duct by which urine is discharged from the bladder. No, that's false. The urethra is the duct by which the urine is discharged from the ureter, takes urine from the kidney to the bladder. Think about your anatomy and physiology. I'm purposely answering these wrong because sometimes we learn better by wrong than correct answers. Pelvic muscle exercises can assist in reducing stress incontinence. Is this true or is this false? It's true. And for older people, these exercises can help to hold the urine long enough to get to the toilet. Abdominal examination allows for an assessment of retention of urine in the bladder. Can you assess urinary retention by looking at the abdomen. Think about your head-to-toe assessment that you did in the in Nursing 100. And you can detect urinary retention only if there's a fair amount of urine in that bladder, usually more than 500 mLs. Functional incontinence may be due to physical impairments causing poor mobility and difficulties in getting to the bathroom. Is that what functional incontinence is about? The answer is true. A new environment may cause functional incontinence if the patient is not aware of whom to ask for help or location of the toilet. There are several effective medications for treating stress incontinence. Is that true or is that false? False. There's only one drug currently licensed. It is not recommended due to its side effects. When the bladder remains full and does not empty completely, this is known as overflow incontinence, urgency incontinence, functional incontinence, and stress incontinence. Let's try overflow. That's correct. The most common surgical solution to stress incontinence women is the insertion of a plastic mesh tape underneath the middle of the urethra. I'd say false. No, it's true. This is affected in older women. A fluid balance chart should be completed only by the patient. The chart can be also completed by the nurse or carer, whoever is the most appropriate. Pelvic muscle exercises are a quick solution to stress incontinence. Remember, every word must be true to make it a true statement or a false statement. That's false. To see an improvement in incontinence symptoms requires motivation and commitment because these exercises must be carried out regularly and over a long period of time. Involuntary urine leakage when people laugh, cough, sneeze, or exercise is known as what kind of incontinence is that? Think about what each of them represents. It's stress. So that's the elimination incontinence game. So you might want to go over those. I think when you do it a few times, you do get a different set of questions. So there's quite a good amount in here. All right. Well, this concludes my online lecture for our concept of elimination and for our exemplars of constipation and diarrhea. Make sure you also review those YouTube videos. The first one was the colon, rectum, and anus, and make sure you go over those and just reviews a little bit of your anatomy and physiology. Have a great day, and if you have any questions, please let me know. Thank you.